and just, all right, so this is going to be your oral boards mock. And so we'll go ahead and I'm going to screen share and then we'll get going. We'll basically do a script before each of the two cases. So let me just get to the right slide here.
And we're not doing a trial run, right? We're just gonna
We're doing it.
record it. Okay,
Yeah,
let's do it
we're
live.
on right now. So yeah. Okay. So I'm going to go ahead and share. And oops. Okay. So, Dr. Tacheny, you're doing your mock certifying exam today. We're going to do two different cases. There's going to be a prioritization case and a clinical decision-making case. And I'll give you a short introductory statement before each one. Do you have any general questions before we begin?
No questions.
Okay. So the first case is going to be a prioritization case. Please keep in mind that while prioritizing care, patient information and diagnostic results may be very limited. Sometimes I may interrupt you to move through the case. This does not reflect your performance. In the time allotted, you may not have an opportunity to completely manage every patient on your tracking board. You will have 15 minutes to complete the case. Before we begin, do you have any questions?
Nope, I'm ready to begin.
All right. So you are a single covered emergency physician working at a community hospital. There are 6 patients waiting to be seen. After reviewing the tracking board, let me know when you're ready to proceed.
All right. I'm ready to proceed.
What 2 to 3 most important specific pieces of additional information from the history, physical exam, or immediately available diagnostic testing would you like to know about each patient in order for you to prioritize their care?
Okay, so for patient A, I'd like to know his past medical history, if he's like immunocompromised in any way. I would just like to know generally how's his like respiratory drive, respiratory status, if he's feeling short of breath, and then I would like an x-ray of his chest. For patient B, um, I guess I would like to know symptomatically how is she feeling with this bleeding, if she's on any blood thinners, and then I would like someone to look at the fistula itself and kind of describe the bleeding, see if it's actively bleeding currently. Um, for patient C with the headache, um, she's a 24-year-old woman, so I'd want a pregnancy test on her. I would like to know her past medical history, if she's had headaches before, and then if she would have described this headache as kind of sudden onset worst, like thunderclap headache. For patient D, I'd like to know his past medical history, kind of his immunization status, and then I would like to know for him how he's doing in terms of like tolerating his secretions, and like if anyone sees any large masses in his throat. For patient E, I would like to know his neurologic status, and that would be the biggest thing for him. Kind of past medical history and maybe mechanism of the motorcycle crash would be helpful. Um, and then for patient F with the knee pain, I'd just like to know what the knee looks like itself. If there's any deformities, I would like to know their distal neurovascular status, and then get an x-ray of the knee that is in pain.
All right. So here is your updated tracking board with additional patient information. Additional diagnostic studies are available for you to view on request. After reviewing the tracking board and any additional stimuli, please let me know when you're ready to proceed.
Yeah, so I'll look at both x-rays we have, the chest x-ray for patient A and then the knee x-ray for patient F.
All right, so here is your chest x-ray.
All right,
One more view for the first patient.
perfect.
And then for the patient F, here is her x-ray. You get one view.
Okay, perfect.
Okay.
And then go ahead.
All right. So based on what you now know, which patient do you want to treat first, and what immediate stabilizing treatment would you provide?
The first patient I would like to treat and assess would be patient E. The motorcycle crash. I'm worried based on his GCS and his respirations that he will need to be intubated. He's only satting 86% on a non-rebreather. So I would go ahead and intubate this patient. Um, and then he would need to get kind of full trauma, pan scan, CT scans, and labs.
All right. You have stabilized your first patient. Which patient would you like to see second and why? And what immediate actions would you take?
So the next patient that I would like to see would be patient B, the bleeding dialysis fistula. Um, again, I'd like to take the dressing off to assess if it's bleeding. If it sounds like there's active bleeding, we would need to kind of hold pressure on that, and then reach out to vascular surgery. That would be the biggest thing for her.
All right. You have stabilized your second patient. Which patient would you choose to evaluate third and why? And what immediate actions would you take?
The next patient that I would like to assess would be patient F, the 12-year-old with knee pain. Um, I'd like to, get an IV in, give her some pain medication, um, and reduce her dislocated patella.
Okay. You have stabilized your third patient. Before you could evaluate the remaining patients, two additional patients, G and H, arrive in the emergency department and have been added to your tracking board. Considering the remaining initial patients and the arrival of two new patients, who would you assess now and what immediate stabilizing treatment would you provide? And again, the blue dot indicates an additional stimulus if you'd like to look at it.
Yeah, I'd like to look at that chest x-ray for patient H.
There's one view.
Okay, sounds good. And I'd like to see this patient next. So for him, I'm worried about a right-sided pneumothorax. So I would go ahead and place a chest tube, a pigtail chest tube on that right side.
All right. All of your patients have been assessed and stabilized. Thank you, doctor. This concludes your case. And what we'll do then is go ahead and move on to the other case, which is the clinical decision-making case. And then we can come back and do a little bit of debriefing on both of these.
Okay.
So let's see. So for the clinical decision-making case, this again is there's no role playing in this. You should simply respond to the questions I ask. And at times I may ask you general questions regarding your clinical decision making, and I may interrupt you to move through the case. This is not a reflection of your performance. You have 15 minutes to complete the case. Do you have any questions?
No questions.
All right. So the patient we'll be discussing is a 24-year-old woman. She's presenting with abdominal pain, and here is her initial information. After you've reviewed the information, what specifically would you ask the patient or family or EMS as part of your history?
Yeah, so I would, want to speak to the patient. I would first kind of ask her, a little bit more about her pain, if she's ever had the pain before. Um, if she's having it currently, is it come and go? Those kind of questions, characterizing her pain a little bit. And then I would want to ask a little bit more about any associated symptoms. So things like fevers, nausea, vomiting, any like pain when she pees, going more frequently than she normally would go. Talk a little bit about kind of bowel movements, if you're having normal bowel movements, any diarrhea, blood, and then also more of like a gynecologic history. So vaginal bleeding, vaginal discharge, any chance that she could be pregnant. Has she ever had a child before, been pregnant before, any history of like STDs, things like that. And then also just a little bit more about her past medical history herself. If she has any medical problems, takes any medicines, had any abdominal surgeries in the past. That's where I would start with my history.
All right. And can you please then discuss specifically what you will be assessing on a physical exam?
Yeah, so on a physical exam, I really want, to focus on her abdominal exam and a GU exam. So I'd be, pressing on her abdomen, all four quadrants, looking for any tenderness anywhere. Um, in terms of I'd also be wanting to see if her abdomen is, rigid, if I'm worried that this is like an acute surgical process. In terms of a GU exam, I'd want to look just generally, is there any blood, any discharge, any adnexal tenderness or masses that I'm noticing on a bimanual exam?
All right. Here are the additional historical and examination findings. When you're done reviewing this information, please let me know when you're ready to proceed.
All right, I'm ready to proceed.
At this point, based on what you now know, what are the top 3 items in your differential diagnosis?
Yeah, so the top three things in my differential diagnosis would be some sort of like ovarian pathology, specifically an ovarian torsion, given kind of the sudden onset and the sharp pain, as well as the adnexal tenderness. With the adnexal tenderness, I would think about things like a tubo-ovarian abscess or an ectopic pregnancy. And then also I would consider an appendicitis.
Based on what you now know and your differential diagnosis, what, if any, diagnostic studies would you order or perform?
Yeah, so I would want to get labs. So I'd want to get urine testing, a urine pregnancy test, as well as a urinalysis. I would want to get a CBC, a CMP. Given that some of my items on my differential are surgical, problems, I'd want to get like coags and a type in screen. Um, yeah, I think I said CBC, a CMP, and then I'd want to get a pelvic ultrasound.
All right. Doctor, I have a question for you that is not specific to this particular patient. For a female patient with abdominal pain, how would a positive pregnancy test change your differential diagnosis?
Yeah, I think a positive pregnancy test would make me more concerned about something like an ectopic pregnancy, a ruptured ectopic pregnancy.
Okay, here is the result of the workup completed in the emergency department. At this point, what treatment or actions would you take for your patient in the emergency department?
Yeah. So, overall looking at her workup, most of the blood work looks pretty normal. It doesn't have a urine infection and she's not pregnant. I'm worried about her pelvic ultrasound showing decreased blood flow to her right ovary. So that would concern me that she does have an ovarian torsion. So I would like to, treat her pain. We can give her some IV morphine, start her, maybe just give her a bolus of fluids for now, like lactated ringers. And then the biggest thing I'd like to do is call gynecology, as I think they need to take her to the operating room.
Doctor, I have an additional question for you that is not specific to this particular patient. If you are caring for an otherwise healthy patient with presumed intra-abdominal sepsis, what would be your antibiotic choice and why?
Yeah, so I would choose something like ceftriaxone plus Flagyl or metronidazole. I'd like to cover um, you know, all the typical organisms. So you got your gram positives, which would be covered by the ceftriaxone, and then all of the anaerobes that would be covered by the metronidazole.
The patient has been evaluated and stabilized in the emergency department. At this time, what would you discuss with the patient and family regarding your evaluation?
Yeah, so I would just discuss with them that the pelvic ultrasound is worrisome for something called an ovarian torsion, which typically happens when someone has a cyst, a large cyst that causes the ovary to twist and decreases the blood flow to the ovary, which ultimately will lead to that ovary dying if we don't intervene on it surgically. So I would let them know that we've already talked to the surgeons and that they'll be down shortly, but should plan on going to the operating room shortly.
What is your final diagnosis for this patient?
My final diagnosis is a right ovarian torsion.
So you've decided to admit this patient. When transitioning care to the admitting physician, what information would you convey or what information would you convey?
Yeah, I would let them know that I have a 24-year-old female who, if I remember correctly, is otherwise healthy that came in with right ovarian torsion that was seen on ultrasound. She is going to be going to the operating room with gynecology for definitive management. She's hemodynamically stable.
All right. Thank you, doctor. That concludes your case. All right.
Oh,
Yay.
I
You did.
forgot to hit record. I'm just kidding.
Yes, very funny. Oh, great. You did really awesome with this. So we don't have to do it again. Yay. So let's just talk for a second. So I'm going to give you the recap of the prioritization cases. So if we go back again, I'll do a separate recording for anyone listening. Look at the other recording a little bit more about how these things play out. But for the scoring for both of these, there's score sheets where you're just literally I'm checking off boxes if you were saying the right thing. And so it's very algorithmic. And they do want you to prioritize, basically always it's going to be life threat over, limb threat, I think would probably be the easiest way to put it. And then go on from there based on what you think is appropriate. And there should be always one appropriate patient that you should go for first. And you did this entirely correctly. The motorcycle crash with a head injury and airway compromise should be your first one. The dialysis fistula bleeding patient should be your second one, since the first one is a life threat. They don't have an airway, so you appropriately secure their airway. The second one is meant to be, again, a potentially heavy bleeding situation. They're hypotensive. So that would be your second threat. And then the third one, as you correctly chose, would be your patellar dislocation, because now the rest of these would be like life-threatening or limb-threatening, but you want to go ahead and get that patient's patella dislocated or relocated in a time-sensitive way. And so that would be your third one. If there was a patient with a neurovascular problem, that would definitely be sort of your next patient as well. And this patient didn't have that neurovascular issue, but she's got a patella dislocation, so you want to get that thing back in. And then they introduce more patients, which again is going to happen in this kind of a scenario. And so your next patient that you want to see before any of the other old patients is going to be the patient who has a spontaneous pneumothorax with hypoxia. Because again, we're going back to, sort of a potential life threat or very time sensitive situation, because it's a patient who already is hypoxic from the pneumothorax. So you prioritize those all really well. I think you chose additional, like, you chose the sort of the stimuli that you sort of needed in order to help you, the information. And again, they're going to ask you, what are the few additional pieces of information that you want. And that can certainly be things like you chose for patients, their past history, immunization status for a kid, pregnancy tests for women, Certainly initial x-rays or imaging studies are all appropriate and fair game to be asking, to get for that dialysis fistula patient. Certainly having someone look at it would be appropriate. Um, and then definitely things like simple like neurostatus for for a patient, that's also appropriate to to ask for. So I think you chose those all very well. I think you could ask for things like the kid with the sore throat. You could ask for a point of care strep, that would be appropriate, or a mono test. Those would also be would be appropriate to do. So overall I think you did a great job with that. uh, all right, I think that's pretty much it for that one. And I think then the other patient, again, you sort of you did this very well. It's basically going to be, what do you want to know about history? And then pretty much ask all the historical questions that you can think of. You had plenty of time for both of these, and so feel free to to ask all the questions you would normally ask in the scenario. Keep it relevant for emergency medicine, but it's meant to be a complete history. And then they're going to ask you about physical exam, and you're again going to go ahead and say anything you think would be appropriate. And I think you did a really nice job of focusing in on abdominal exam, on GU exam. If you thought there were other questions you needed to ask for other organ systems, sure, great. But it's okay to again give an emergency medicine, this particular problem focused exam. And then they'll ask you about what you want to order as far as you know, um, any sort of testing. And again, this can be both lab testing, this can be imaging testing. They'll feed that back to you, and then they're going to ask you about your differential. And if they say I want three, you do need to give three. You sort of snuck in a fourth because you said ovarian torsion, and you said TOA, they said or ectopic, and it's like, well, wait a minute, that's three, and then you added appendicitis. So do try to make sure you're answering the specific question that's asked of you. If they ask for three, they'll take your first three, and then that's going to be it. So do that, and then they will ask you for your final diagnosis. Basically how you're going to counsel the patient and the family, since that communication skill is also something that's being quizzed, and then how you're going to hand off, since hand off or sign out is again something that's very important. They're going to want to know about, and I thought you did all of those things very well, and put all the this is the only time where you're going to sort of like give the non-medical language to the family and the patient. And then for the sign out, of course, that's going to be very medical, and they're going to want your general things like what are the patient, what was the patient's initial chief complaint, how did they look, were they stable or unstable, what kind of interventions did you do, and then basically what the anticipated plan is going to be for the patient. So you hit all of those. You did a really great job on that. So overall, very well done. Do you have any questions about any of the specifics for the cases?
No questions.
No questions. All right. Well, that's it. Then if you want to go ahead and stop recording.